All right, so it looks like we've got everybody in that was registered. I'd like to introduce myself. My name is Shirley Villardo. I'm the Director of Clinical Services at Jewish Family and Children's Service of Greater Mercer County. Thank you all for joining us for our webinar, Let's Talk About Therapy. Our agency continues to be here to serve the community during this challenging time by adapting our services to meet your needs. We are proud to be able to share the professional insight of our licensed counselors in order to provide much needed emotional and psychological support as we navigate this crisis together. The presentation today will be led by Teri Cheresnick. Teri is a licensed clinical social worker and a licensed clinical alcohol and drug counselor. Teri works with clients of all ages and helps them manage chronic anxiety, depression, stress, and other health concerns. Throughout the presentation, please feel free to submit any questions through the Q&A or the chat, and Teri will address them at the end of the presentation. So at this time, I'd like to hand it over to Teri. Teri, take it away.
Okay, thank you, Shirley. And thank you everyone for taking the time out of your day to listen to this webinar. Perhaps you've never met with a therapist before and are unfamiliar with psychotherapy. Or maybe you have participated in therapy and still have some questions about it. In the 20 minutes we have together, I'll cover a few topics that may be beneficial for you to know. So first, let's identify what is therapy. So psychotherapy, also known as talk therapy or just therapy, is a form of treatment designed to help people with emotional difficulties and mental health problems. Psychological problems are treated through communication, which is grounded in dialogue and relationship factors between a client and their therapist. Dialogue, as we know it, is communication, verbal and nonverbal, between at least two people. But relationship factors seem a bit more vague, don't they? It's the trusting relationship between an individual and their therapist, which is essential to working together effectively and benefiting the individual from therapy. Therapy provides a supportive environment that allows you to talk openly with someone who is understanding, objective, and non-judgmental. The purpose of therapy is to help the individual increase a sense of well-being and eliminate or control distressing symptoms so they can function better in their life. Some of the problems that can be helped by therapy are life problems, such as coping with losses, such as a death, divorce, or loss of a job. Adjusting to life transitions, such as the empty nest when children leave home. Dealing with a serious physical health problem, recovery from abuse, to resolve conflicts with your partner, but also specific mental health disorders, such as depression, PTSD, anxiety, or bipolar disorder, to name a few. So secondly, who provides therapy? Well, in New Jersey, therapy can be provided by several licensed mental health professionals, such as a psychiatrist, psychologist, counselor, social worker, or a psychiatric nurse. A psychiatrist is a medical doctor who specializes in diagnosing and treating mental illness and is licensed to write prescriptions. Many mental health disorders, such as depression, anxiety, and schizophrenia, are treated with medications along with talk therapy. The psychiatrist will conduct an initial psychiatric evaluation to determine if medication would be beneficial for an individual. Sometimes it's a combination of medication and therapy that is needed to best treat the mental health condition. Many mental health disorders, such as depression, can have a biological basis, and being prescribed a medication may be part of your treatment plan. If medication is prescribed, the psychiatrist will meet periodically with the client for brief medication management sessions, and the client will usually receive talk therapy on a more frequent basis, perhaps bi-weekly, with another licensed mental health professional, such as a psychologist, LPC, LMFT, or LCSW. So I'll explain what these letters mean. The letters after a person's name indicate their credentials. The following licensed mental health professionals are all qualified to evaluate and treat emotional difficulties and mental health disorders, but cannot prescribe medications. A psychologist holds a doctoral degree, PhD, PsyD, or EdD, in psychology, which is the study of mind and behavior. Licensed psychologists can also provide psychological testing. An LPC is a licensed professional counselor, and an LMFT is a licensed marriage and family therapist. Both have master's degrees in counseling. An LCSW is a licensed clinical social worker and has a master's degree in social work. There is also an APRN designation, which is a licensed advanced practice registered nurse. This individual is a registered nurse who has specialty training in mental health services and is able to prescribe medications along with providing treatment for mental health disorders. Don't ever hesitate to ask your therapist what the letters after their name means. Letters, in addition to those I mentioned, may indicate additional certifications or training. For example, LCADC is a licensed clinical alcohol and drug counselor. You're paying for their services and have a right to know the credentials of the person providing your care. Believe me, they won't be insulted if you ask. So, what are some reasons people go to therapy? There's many reasons why someone may go to therapy, but a few of the more common reasons are, perhaps you're having difficulty managing your emotions. While everyone feels upset, sad, or angry at some time in their life, it's important to pay attention to how often or how intensely you feel these emotions. For example, if you feel continually sad, hopeless, or disengaged in your daily life for at least 2 weeks or longer, it may be a sign of clinical depression, which is different from an occasional depressed mood. Perhaps you notice a decrease in your level of effectiveness in your role at work, home, or school. Maybe you're experiencing noticeable changes in your sleeping pattern. You're sleeping too much or too little, or you've got changes in appetite. Either you're overeating or not eating enough. Perhaps you're having difficulty in your interpersonal relationships. Maybe in your past you've experienced trauma, whether it's sexual abuse, domestic violence, or another trauma that you haven't recovered from. Perhaps you no longer find pleasure in activities you once enjoyed. When you struggle with a psychological issue, feelings of disconnectedness can cause a person to have a loss of interest in hobbies, socializing, and other activities. Maybe you're experiencing grief. Grief can be a response to many losses, not just the death of someone we care about. We can grieve the loss of a relationship, the loss of a job, and sometimes we need help to process these painful feelings. And lastly, you use an unhealthy substance or activity to cope with stress. At times when we're feeling overwhelmed, we look for relief by using something to numb our emotions, and that can be alcohol, drugs, or sex. So, what does a typical therapy session look like? Well, when you first call for a therapy appointment at JFCS, an intake specialist will ask a few questions to gather some pertinent information to pass along to the therapist who you will be meeting with. You'll be asked for a general description of why you're coming to therapy. That's what we call the presenting problem. The reason the intake person asks is to be sure that we are able to provide services for the problem you're dealing with. For example, if someone has experienced a drug addiction, we would refer them to another provider, as we do not provide substance abuse counseling as a primary disorder. Now, the intake caller is bound by the same HIPAA laws regarding confidentiality and privacy of healthcare information as is the therapist. So after the intake specialist speaks with you, the therapist will phone you and schedule an initial assessment session, which will last for about 1 hour. This time is a getting to know you session, where the therapist will complete what is called the biopsychosocial assessment, asking questions to better understand your background, current problems, symptoms, as well as strengths. Oftentimes, more than one session is needed to gather information to conduct a thorough assessment. We don't want anyone to feel rushed while sharing their personal story of life experiences. At the initial assessment, paperwork will also be reviewed, such as HIPAA forms regarding confidentiality of healthcare information, agency policies regarding attendance and other issues, and insurance information. Once the assessment is completed and it is determined that JFCS is the appropriate level of care for your presenting problem, the therapist and client will together develop a treatment plan, which defines the problem and goals for the treatment focus. It's important for both client and therapist to understand what is the endpoint. When will we both know that therapy has been successful? Therapy can be held individually, as a couple, with a family unit, or in a group with a common treatment focus. Therapy is also available to anyone from childhood to elderly adults. Here at JFCS, we can provide therapy services for children starting at age 5 up to adults at any age. Sessions are usually held every 2 weeks and last approximately 45 to 50 minutes. The length of treatment can vary depending on the complexity of issues, which are the focus of treatment. The treatment goals and decisions for how often and how long to meet are collaboratively discussed by the client and therapist. Today, due to concerns regarding the COVID-19 virus, all therapy sessions at JFCS are being conducted through video teletherapy on Zoom. Many other agencies and therapists throughout New Jersey are also providing therapy via teletherapy. There's both advantages and drawbacks to this mode of providing therapy. However, the therapists here at JFCF have found that overall, clients have enjoyed the many advantages of video teletherapy. Some of the benefits of engaging in therapy remotely are: there's no need to travel to an office. You receive services in the comfort of your familiar surroundings. It's an easy process. Your therapist emails you a link, which you click on at the time of your session to connect for a session. So next, how can therapy be beneficial? Well, therapy is more than just talking things over with a friend, getting things off your chest. While talking to a friend or loved one can be helpful, sometimes more than just a sympathetic ear is needed. Some ways that therapy can be beneficial are: therapy can help a person learn to identify and change the behaviors or thoughts that are adversely affecting their life. Therapy can assist with developing more healthy, effective ways to cope with and solve various stressors and problems. And therapy can assist you in having more meaningful relationships in your life. If someone has a diagnosable mental health disorder, such as depression or an anxiety disorder, therapy can also help the individual to understand the illness, eliminate or decrease the symptoms, and improve their daily life interactions. According to Dr. Ramani Durvasalu, a clinical psychologist, therapy is an honest, objective, and confidential space that allows a person to explore uncomfortable feelings, understand its root causes, place it in a context, and learn coping skills to overcome those feelings. Additionally, it's a trusting space where you can be vulnerable and explore deeper issues that require the assistance of a trained professional. So, what would be helpful to know about therapy? Well, the relationship between the therapist and client is a professional relationship, which means that the relationship's purpose is to benefit the client, and that there are established boundaries or limits that are deemed appropriate according to the ethical standards set by the therapist profession, for example, the Social Work Code of Ethics. This therapeutic relationship is different from your other relationships. The therapist is bound to keep confidential the information you share with them, with a few exceptions. One being if you ever express that you're going to harm yourself or others. So aside from that, you can feel comfortable and confident that what you say and talk about will stay with your therapist. That may not always be true of your conversations with friends and family. The focus of the session is on you. The therapist is there to assist you with compassion and without judgment. Therapists will reveal very little about themselves to clients. And if they do share something of a personal nature, it will be in the service or for the benefit of the client. While it may seem like a nice idea to be able to continue a relationship outside of the therapy sessions, this is not possible. The therapeutic relationship is not a two-way relationship where both parties get to know each other. The role of the therapist is to help their client, never the other way around. Most therapists genuinely care about their clients and want to see them improve, and establishing healthy boundaries helps with this process. So at the initial session, most therapists will provide information to the client regarding agency policies, such as cancellation, no-show policy, policy related to fees and insurance, how to best contact your therapist between sessions, etc. Discussing this information early on can help to clarify expectations and responsibilities for both client and therapist, and help prevent any misunderstandings later on. If you have any questions at any time, don't hesitate to bring them up with your therapist. Remember, they're there to be of help to you. So for therapy to be successful, research has found that one of the most important variables is the therapeutic relationship between the client and the therapist. One pioneering expert on this topic, Dr. Edwin Borden, defined a good therapeutic relationship as consisting of three essential qualities: an emotional bond of trust, caring, and respect, agreement on the goals of therapy, and collaboration on the work or task of the treatment. Along with a strong therapeutic relationship, there are several factors that can promote positive therapy outcomes. Regular attendance to the sessions, being willing to have those difficult conversations, sharing honestly in a session, fully participating in therapy, and being open to feedback, and completing any tasks or written exercises outside of the session. Therapists can engage in various approaches or types of psychotherapeutic treatment. The type of therapy may depend on the presenting problem of the client, as well as the therapist's preference and training. There are many types, such as cognitive behavioral therapy, known as CBT, which helps people identify and change thinking and behavior patterns that are problematic, and replacing them with more accurate thoughts and functional behaviors. Dialectical behavior therapy, which is DBT, is a specific type of CBT that helps regulate emotions by teaching new skills to help people take personal responsibility to change unhealthy or disruptive behavior. And psychodynamic therapy, which is based on the idea that our current behavior and mental state is influenced by our past childhood experiences and thoughts or feelings that are outside of the person's awareness. Working with a therapist, a person begins to increase self-awareness and change old ways of behaving to more fully take charge of their life. Oftentimes, the therapist will use an eclectic approach, incorporating a range of proven methods from a variety of disciplines to best help the client. This approach customizes the therapeutic process for each client. So finally, how can I find the right therapist for me? Well, what's very important, I think, to do initially is identify what's important to you in a therapist. Do you prefer working with a man or a woman? Would you prefer someone who uses an eclectic approach? Or if you're familiar with DBT, is that something you prefer? Is someone whose client focus is LGBTQ important to you? Kind of narrowing down what you're interested and need to focus on can help you decide what's most important to find in your therapist. So then ask friends and family, people you trust, for their recommendations. Maybe they've had a positive experience with someone and can recommend them for you. How about calling your health insurance company for a list of in-network providers or go to their website to look. Another good site is psychologytoday.com. They have a free therapist search tool that helps you choose a local therapist using various search criteria. And lastly, ask your primary care physician for a recommendation. For anyone who is hesitant about connecting for therapy, let me share this. Do you think it would be realistic or a good idea for a person to go from birth throughout their entire life and never see a medical doctor for physical problems? Probably not. Throughout our life, we are bombarded with many outside toxins, viruses, germs. We also have body parts and systems that wear out, get overstressed. For both of these stressors, external and internal, we may need professional help, medical help, to deal effectively with the problem. And it's the same with our mental health. Is it realistic to think that we can go throughout our entire life without needing some professional help for mental health related problems or concerns? Our mental health is just as important as our physical health. So when you're in need of therapy, remember, JFC is here for you. Don't hesitate to give us a call. Thank you so much for watching and listening today. And Shirley, I'll pass it back to you.
Great, thank you. We certainly learned a lot about therapy. Your information was very helpful. So let's see what we have as far as questions. Is all therapy covered by insurance? And can I get services if I do not have insurance? So I believe that most insurance companies do cover mental health care, and certainly we do have grants and can work with clients who do not have insurance if they meet the requirements as far as financial eligibility. Teri, did you want to add anything to that?
No, but what I would like to do, if I could, I know we received a question right before that we started our webinar, and someone asked a question I'd like to take a moment and answer if I could. This individual sent us an email asking, how long should therapy last? So that's a really good question, but there's no quick answer to that one. Therapy does not have a set length of treatment. At the beginning of therapy, a treatment plan's developed, which clearly defines the problem and the goal. So a person may have a life difficulty, let's say a loss of a job, or a recurring mental health disorder like depression. The one issue may be helped with short-term therapy, maybe 6 to 8 sessions, whereas it may take longer to address the depression. Therapy can last for several weeks, months, or depending on the presenting problem, years. It all depends on what the client needs. Remember too that the frequency of sessions can be weekly, bi-weekly, or monthly. The purpose of therapy is to help you attain the agreed upon goals. And that really is the engine that fuels the train. What is the purpose and have you met your goals? To help figure out if you've met goals, you and your therapist every 3 months will do what's called a treatment plan review that discusses progress, what still needs to be worked on, so you really can gauge how far you've come and perhaps how much further time-wise you need to be working together. You know, there's also a few other factors that can contribute to the length of therapy. Is it a chronic, ongoing condition that you're dealing with? Has the person been in therapy before and has a set of coping skills to refer to? And what type of therapy is being used? CBT is a more of a short-term to a medium-term therapy, whereas psychoanalytical oriented therapies can go on for much longer. So ultimately, the length of therapy is a joint decision which will be made by both the client and the therapist.
Great. Right, and Teri, someone wants to know, what if a child or teenager wants to pursue therapy, but maybe their parent or guardian are resistant?
That's a good question. I wish I had a little more information to answer it a little better, because if the person's under 18, it would be very difficult to get the child into therapy without the parents, permission. Hopefully we could have a discussion initially with the therapist and parents to try to help them understand, or for us to understand, what are the underlying causes of why perhaps they aren't willing or interested in having their child engage. And perhaps maybe if they'd be willing to initially have some family sessions to share their concerns along with the child, that perhaps could be beneficial.
Okay. And then there's a question relating a little bit more to confidentiality. So when a youth is in therapy, is what's shared in therapy then shared with the parents, or is this kept confidential?
Well, as a therapist, we certainly like to keep what is discussed with the adolescent, between the adolescent and the therapist. However, just like with adults, if a child or adolescent shares information that they have thoughts of self-harm in any way or harming others, of course, we immediately contact parents and certainly see about what other additional services we might have to bring in. But if we're going to have a child or an adolescent meet with us as a therapist, they have to have a certain comfort level with meeting with us, and knowing that not everything that they say to us, we're immediately turning around and sharing with parents, because that will shut down conversation immediately. So while we'll be willing to give a sense of how is therapy progressing overall, with parents, we don't want to get caught in specifics, because then it really impacts the client, the adolescent, being willing to talk with us. However, if it's anything of a pertinent, urgent, crisis nature, of course, parents will be brought into the conversation.
Absolutely. And then there was a suggestion from one of the participants, Betsy. Hi, Betsy. Betsy suggested that maybe the teen or child talk to a school social worker. And that's a very good suggestion.
Absolutely. Absolutely a good suggestion.
So it looks like there's no more questions. I'd like to thank you all, and certainly to thank you, Teri, for your great presentation. I'd like you, first of all, if anybody has any other questions, certainly feel free to reach out to us. And I would like to make you aware that JFCS has what we call drop-in hours. So we offer a 30-minute free counseling session, and we have hours scheduled throughout the week, Monday, Wednesday, and Friday from 10 a.m. till noon, and on Tuesday and Thursday from 5 p.m. to 7 p.m. So certainly if you feel that that would be helpful, that, feel free to call in. And again, if you have any questions, feel free to reach out. We really appreciate your time today, and look forward to seeing you all at our next webinar. Thank you so much. Bye-bye.